AIDS. Acquired immune deficiency syndrome, AIDS, is a chronic, life-threatening condition caused by the human immunodeficiency virus, HIV. AIDS is a condition where the immune system of the body is weakened. It leads to the increased risk of developing serious infections and cancers. Human immunodeficiency virus, HIV, is a virus that attacks and weakens the immune system of the body. It primarily targets and infects the CD4 T-cells, which are a type of white blood cell that helps fight infections. HIV is transmitted through the exchange of bodily fluids such as blood, semen, vaginal fluids, and breast milk. The most common modes of transmission of HIV are unprotected sexual contact, sharing of needles or syringes, mother-to-child transmission during childbirth or breastfeeding, and blood transfusions or organ transplants from an infected donor. HIV infection progresses through several stages. The initial stage is the acute or primary infection stage, which occurs within the first 2 to 4 weeks after infection. During this stage, a person may experience flu-like symptoms such as fever, fatigue, and swollen lymph nodes. The second stage is the clinical latency stage, also known as the chronic or asymptomatic stage, during which HIV reproduces at a low level in the body, and there may be no visible symptoms. This stage can last for many years, depending on the individual. Without treatment, HIV can progress to the third stage, known as AIDS. AIDS is a condition where the immune system is severely damaged, leading to the increased risk of developing serious infections and cancers. AIDS is diagnosed when a person with HIV infection has a CD4 T-cell count below 200 cells per cubic millimeter of blood, or when the person develops an AIDS-defining condition such as kaposi'ssarcoma, pneumocystis jirovecii pneumonia, or cryptococcal meningitis. The main difference between HIV and AIDS is that HIV is the virus that causes the infection, while AIDS is the final stage of the infection when the immune system is severely damaged. A person can have HIV without having AIDS, but all people with AIDS have HIV. In summary, HIV is a virus that attacks and weakens the immune system of the body, primarily by targeting and infecting CD4 T-cells. HIV can progress to AIDS if left untreated, which is a condition where the immune system is severely damaged, leading to an increased risk of developing serious infections and cancers. Early diagnosis and treatment of HIV infection can help to slow down the progression of the disease and improve the overall health and quality of life of people living with HIV. What's a retrovirus? A retrovirus is a type of virus that has RNA as its genetic material instead of DNA. It is the genetic material found in most living organisms. Retroviruses are unique because they have an enzyme called reverse transcriptase. It allows them to convert their RNA into DNA once they infect a host cell. Once the retrovirus has converted its RNA into DNA, the viral DNA can then be integrated into the host cell's genome. This means that the host cell will produce viral proteins and replicate the viral DNA along with its own DNA, allowing the retrovirus to persist in the host for long periods of time. The process of integrating the viral DNA into the host cell's genome is called retroviral integration. One of the most well-known examples of a retrovirus is HIV, the virus that causes acquired immune deficiency syndrome, AIDS. HIV is a retrovirus that targets and infects CD4 T-cells, a type of white blood cell that helps fight infections. Once HIV infects a host cell, it uses its reverse transcriptase enzyme to convert its RNA into DNA, which is then integrated into the host cell's genome. Over time, the HIV-infected host cell will produce new copies of the virus, leading to the progressive destruction of the immune system and the development of AIDS. Retroviruses are important because of their unique mechanism of replication and their ability to integrate their genetic material into the host cell's genome. This property has been harnessed for various medical applications, including gene therapy and the development of retroviral vectors for the delivery of therapeutic genes into cells. However, retroviruses can also cause disease and are responsible for several types of cancers and immunodeficiency disorders. AIDS-defining illnesses. AIDS-defining illnesses are a group of medical conditions that occur in individuals who have HIV. and have progressed to the advanced stages of the disease, where the immune system is severely compromised. The Centers for Disease Control and Prevention, CDC, has defined a list of AIDS-defining illnesses, which includes the following. 1. Kaposi'ssarcoma, KS. Kaposi'ssarcoma is a type of cancer that causes the growth of abnormal blood vessels in the skin, mucous membranes, and other organs. It appears as purplish lesions or nodules on the skin and can also affect the lungs, digestive tract, and other organs. 2. Pneumocystis jirovecii pneumonia, PCP. PCP is a type of pneumonia caused by the fungus Pneumocystis jirovecii. It is a common opportunistic infection in people with HIV and can cause fever, cough, and difficulty breathing. 3. Cryptococcal meningitis. Cryptococcal meningitis is a fungal infection that affects the membranes surrounding the brain and spinal cord. It can cause fever, headache, and a stiff neck, and can be fatal if left untreated. 4. Tuberculosis, TB. TB is a bacterial infection that primarily affects the lungs but can also affect other parts of the body. People with HIV are at a higher risk of developing active TB disease, which can cause cough, fever, and weight loss. 5. Cytomegalovirus, CMV, disease. CMV is a type of virus that can cause serious infections in people with weakened immune systems. It can affect the eyes, lungs, and other organs and can cause symptoms such as fever, fatigue, and vision loss. 6. Toxoplasmosis. Toxoplasmosis is a parasitic infection that can affect the brain and other organs. It can cause fever, headache, confusion, and seizures, and can be life-threatening in people with weakened immune systems. 7. Candidiasis. Candidiasis is a fungal infection that can affect the mouth, throat, and other parts of the body. It can cause symptoms such as white patches in the mouth or throat, difficulty swallowing, and vaginal itching or discharge. 8. Wasting syndrome. Wasting syndrome is a condition characterized by the loss of body weight and muscle mass, often accompanied by weakness, fatigue, and loss of appetite. It is a common complication of advanced HIV disease and can lead to malnutrition and other health problems. Other AIDS-defining illnesses include 9. Burkitt lymphoma. 10. Candidiasis of bronchi, esophagus, trachea or lungs. 11. Chronic intestinal isosporiasis, cystoisosporiasis, that lasts more than a month. 12. Coccidioidomycosis, spread outside of your lungs, disseminated or extrapulmonary. 13. Chronic intestinal cryptosporidiosis, lasting more than a month. 14. Encephalopathy attributed to HIV. 15. Progressive multifocal leukoencephalopathy. 16. Extrapulmonary cryptococcosis. 17. Herpes simplex ulcers, lasting more than a month. 18. Herpes simplex bronchitis, pneumonitis or esophagitis, onset at age older than 1 month. 19. Histoplasmosis spread outside the lungs, disseminated or extrapulmonary. 20. Non-Hodgkin's lymphoma. 21. Invasive cervical cancer. 22. Immunoblastic lymphoma. 23. Multiple or recurrent bacterial infections. 24. Mycobacterium avium complex, MAC, spread outside the lungs, disseminated or extrapulmonary. 25. Mycobacterium canceracei, spread outside the lungs, disseminated or extrapulmonary. 26. Mycobacterium, other species or unidentified species, spread outside the lungs, disseminated or extrapulmonary. 27. Primary lymphoma of the brain. 28. Progressive multifocal leukoencephalopathy. 29. Recurrent pneumonia. 30. Recurrent salmonella septicemia, non-typhoid. Defining illnesses. It is important to note that the development of AIDS-defining illnesses does not necessarily mean that the person will die from HIV or AIDS. Early diagnosis and treatment of HIV infection, as well as effective management of opportunistic infections and other complications, can significantly improve the health and quality of life of people living with HIV or AIDS. Incidences of AIDS. According to the World Health Organization, WHO, approximately 38 million people worldwide are living with HIV, and nearly 690,000 people died from AIDS-related illnesses in 2019. Causes of AIDS. AIDS is caused by the human immunodeficiency virus, HIV, which attacks the immune system of the body. HIV targets and infects the CD4 T-cells, which are a type of white blood cell that helps fight infections. Over time, HIV destroys these cells, leading to a weakened immune system. Can you get HIV from kissing? The risk of getting HIV from kissing is extremely low. HIV is primarily transmitted through the exchange of certain bodily fluids, including blood, semen, vaginal secretions, and breast milk. Saliva, on the other hand, has very low levels of the virus, and HIV is not typically transmitted through casual contact or social interactions, such as kissing. While it is theoretically possible to transmit HIV through deep, open-mouthed kissing if both partners have open sores or cuts in their mouths, the risk of this happening is very low. This is because saliva contains enzymes and other substances that can inhibit the replication of the virus and prevent it from infecting other cells. However, it's important to note that other sexually transmitted infections, STIs, can be transmitted through kissing, particularly if there are open sores or lesions in the mouth or on the lips. Herpes simplex virus, HSV, and syphilis, for example, can be transmitted through kissing if there are open sores or cuts on the mouth or lips. It's always a good idea to practice safe sex and take precautions to prevent the transmission of STIs, including HIV. This includes using condoms or other barrier methods during sexual activity and getting tested regularly for STIs if you are sexually active. If you are unsure of your HIV status or have concerns about your risk of HIV, talk to your healthcare provider or a sexual health specialist for more information and advice. How AIDS is transmitted. HIV is primarily spread through the exchange of bodily fluids such as blood, semen, vaginal fluids, and breast milk. The most common modes of transmission of HIV are unprotected sexual contact, sharing of needles or syringes, mother-to-child transmission during childbirth or breastfeeding, and blood transfusions or organ transplants from an infected donor. Having a same-sex partner is not a risk factor for acquiring AIDS, acquired immune deficiency syndrome, but engaging in sexual activity that can lead to the transmission of HIV, human immunodeficiency virus, is a risk factor. HIV is the virus that can lead to the development of AIDS. Sexual activity between two people involves the exchange of body fluids, which can be a route of HIV transmission. Anal sex. Anal sex, in particular, is a high-risk activity for the transmission of HIV, regardless of the genders of the partners involved. The lining of the anus is delicate and prone to tearing during sex, which can create open wounds that provide an entry point for the virus. Other high-risk sexual behaviors that can increase the risk of HIV transmission include unprotected vaginal sex, oral sex, especially if there are sores or bleeding gums, and sharing sex toys with someone who is HIV positive. It's important to note that having a same-sex partner does not inherently increase the risk of HIV transmission. The risk of transmission is related to the specific sexual behaviors that someone engages in, rather than their sexual orientation or the gender of their partners. Regardless of sexual orientation or gender, anyone who engages in high-risk sexual behaviors should take steps to protect themselves from HIV and other sexually transmitted infections, STIs. This can include using condoms or dental dams during sexual activity, getting tested for HIV and other STIs regularly, and considering pre-exposure prophylaxis, PrEP, as a preventative measure if they are at high risk for HIV. Symptoms of AIDS. The symptoms of AIDS can vary widely and can range from mild to severe. Some of the early symptoms of HIV infection include fever, fatigue, chills, sore throat, muscle aches, night sweats, rash, mouth sores and swollen lymph nodes. Other symptoms may include headaches, night sweats, diarrhea, and weight loss. As the disease progresses, people with AIDS may develop more severe symptoms, such as severe and persistent infections, recurrent fevers, chronic diarrhea, and breathing difficulties. How AIDS is diagnosed. AIDS is diagnosed through a blood test that looks for the presence of HIV antibodies or the virus itself. A positive test result for HIV antibodies or the virus means that a person is HIV positive. There are several types of tests that can be used to diagnose HIV infection, including antigen/antibody tests, antibody tests, and nucleic acid tests (NATs). Each test has its own advantages and limitations, and the type of test used will depend on the individual's risk factors, symptoms, and the stage of infection. Antigen/antibody tests. Antigen/antibody tests are the most commonly used tests for diagnosing HIV infection. These tests detect both the HIV antigen, a protein produced by the virus, and antibodies to HIV, proteins produced by the immune system in response to the virus, in the blood. These tests are also known as fourth-generation tests and can detect HIV infection within 2 to 6 weeks after exposure. The results are usually available within a few days. Antibody tests. Antibody tests are also known as third-generation tests and detect antibodies to HIV in the blood. These tests are less sensitive than antigen/antibody tests and can take up to 3 months after exposure to detect HIV infection. The results are usually available within a few days. Nucleic acid tests, NATs. Nucleic acid tests, NATs, detect the genetic material, RNA, of the virus in the blood. These tests are the most sensitive and can detect HIV infection within a week of exposure. However, they are more expensive and time-consuming than other tests, and are usually reserved for people who may have been exposed to HIV within the previous week or who have symptoms of acute HIV infection. The results can take several days to a week to be available. In addition to these tests, there are also rapid tests that can provide results within minutes. Rapid tests are typically antibody tests that use a small amount of blood from a finger prick or oral fluid. These tests are less sensitive than laboratory-based tests but are useful for screening large populations or for use in non-clinical settings. It's important to note that a positive test result does not necessarily mean that the person has AIDS. It simply means that the person is infected with HIV and may need further testing and medical care. People who test positive for HIV should talk to their healthcare provider about treatment options and ways to prevent the transmission of the virus to others. Are there at-home tests for HIV? Yes, there are at-home tests available for HIV. These tests are designed to be easy to use and provide a quick, private way for people to test for HIV in the comfort of their own homes. The most common type of at-home HIV test is an antibody test that uses oral fluid, saliva, to detect HIV antibodies. The test typically involves swabbing the inside of the mouth with a testing device, and then placing the device in a tube of testing solution. The results are usually available within 20 to 40 minutes. There are also at-home tests that use blood samples that can be collected through a finger stick or a small tube. These tests work by detecting either HIV antibodies or the HIV virus itself, using nucleic acid tests. The results are typically available within a few days. It's important to note that while at-home HIV tests are convenient and easy to use, they may not be as accurate as tests done in a healthcare setting. False positive and false negative results can occur, and people who test positive for HIV through an at-home test will still need to have the result confirmed by a healthcare provider using a more accurate test. Additionally, at-home tests may not be suitable for everyone, particularly for those who have had recent or ongoing risk factors for HIV, as the test may not detect an infection that occurred very recently. People who have concerns about their risk for HIV or who have symptoms of HIV should seek medical attention and get tested by a healthcare provider. Is there a cure for HIV? Currently, there is no cure for HIV. Once a person is infected with HIV, the virus stays in their body for life. However, HIV can be effectively managed with antiretroviral therapy, ART, which involves taking a combination of drugs that target different stages of the virus's life cycle. ART, antiretroviral therapy, is highly effective in suppressing the virus and preventing HIV from progressing to AIDS. When taken as prescribed, ART can also reduce the amount of virus in a person's blood to undetectable levels. which greatly reduces the risk of transmitting the virus to others. In addition to ART, there are other treatments available to manage the symptoms and complications of HIV infection. For example, medications can be used to prevent and treat opportunistic infections, which are infections that occur more frequently and can be more severe in people with weakened immune systems due to HIV infection. Research is ongoing to find a cure for HIV, but it remains a complex and challenging task. Some of the strategies being explored include gene therapy, immunotherapy, and stem cell transplant, among others. While there have been some promising developments in these areas, more research is needed before a cure for HIV becomes a reality. Treatment of AIDS. Although there is no cure for AIDS, there are several treatments available that can help slow down the progression of the disease and manage symptoms. The most common treatment for AIDS is antiretroviral therapy, ART, which involves taking a combination of medications that target different stages of the HIV life cycle. ART helps to reduce the amount of virus in the blood, slow down the progression of the disease, and improve the overall health and quality of life of people with AIDS. The types of ART medications used in the treatment of AIDS. Antiretroviral therapy, ART, involves taking a combination of drugs that target different stages of the HIV virus's life cycle. There are several classes of ART medications, each with different mechanisms of action. The specific combination of drugs used in ART can vary depending on factors such as a person's individual health status, potential drug interactions, and drug resistance patterns. Here are the major classes of ART medications used in the treatment of HIV. 1. Nucleoside reverse transcriptase inhibitors, NRTIs. These drugs block the action of the reverse transcriptase enzyme, which the virus uses to convert its RNA into DNA. NRTIs are usually taken in combination with other drugs to maximize their effectiveness. Examples of NRTIs include zidovudine, lamivudine, and tenofovir. 2. Non-nucleoside reverse transcriptase inhibitors, NRTIs. These drugs also block the reverse transcriptase enzyme, but they do so by binding to a different site on the enzyme than NRTIs. NRTIs are often used in combination with NRTIs. Examples of NRTIs include efavirenz, nevirapine, and etravirine. 3. Protease inhibitors, PIs. These drugs inhibit the protease enzyme, which the virus uses to cleave long viral proteins into smaller pieces that are needed to assemble new virus particles. PIs are usually taken in combination with other drugs to maximize their effectiveness. Examples of PIs include atazanavir, darunavir, and ritonavir. 4. Integrase inhibitors. These drugs block the action of the integrase enzyme, which the virus uses to insert its DNA into the host cell's DNA. Integrase inhibitors are often used in combination with other drugs. Examples of integrase inhibitors include raltegravir, dolutegravir, and elvitegravir. 5. Entry inhibitors. These drugs block the virus from entering the host cell. There are two types of entry inhibitors: fusion inhibitors, which block the virus from fusing with the host cell, and CCR5 antagonists, which block the virus from entering the cell through the CCR5 receptor. Entry inhibitors are not used as frequently as other classes of ART medications. Examples of entry inhibitors include enfuvirtide and moraviron. Attachment inhibitors and post-attachment inhibitors are two classes of entry inhibitors that are used in the treatment of HIV. Unlike other classes of antiretroviral drugs that target the virus after it has entered the host cell, these drugs work by preventing the virus from entering the cell in the first place. 6. Attachment inhibitors. These drugs block the attachment of the virus to the host cell by binding to the GP120 protein on the surface of the virus. By preventing the virus from attaching to the host cell, attachment inhibitors can effectively prevent infection. However, these drugs are not commonly used in HIV treatment, as they are less effective than other classes of antiretroviral drugs and can have significant side effects. The only attachment inhibitor approved for use in the United States is ibolizumab. 7. Post-attachment inhibitors. These drugs block the fusion of the virus with the host cell after the virus has attached to the cell surface. They work by targeting the GP41 protein on the surface of the virus, which is involved in the fusion process. By preventing fusion, post-attachment inhibitors can effectively prevent the virus from entering the cell. The most commonly used post-attachment inhibitor is enfuvirtide, which is used in combination with other antiretroviral drugs. It's important to note that entry inhibitors, including attachment and post-attachment inhibitors, are not commonly used as first-line treatments for HIV. They are generally reserved for people who have developed resistance to other classes of antiretroviral drugs, or who are unable to tolerate other drugs due to side effects or other factors. Additionally, entry inhibitors can have significant side effects, and people taking these drugs need to be closely monitored by a healthcare provider. 8. Pharmacokinetic enhancers. These drugs are not used to directly treat HIV infection, but rather to boost the effectiveness of other ART drugs. Pharmacokinetic enhancers work by inhibiting enzymes in the liver that break down other drugs, allowing them to remain in the body for longer periods of time. Examples of pharmacokinetic enhancers include kaposi'ssarcoma and ritonavir. It's important to note that ART medications can have side effects, and people taking these drugs need to be closely monitored by a healthcare provider. Additionally, ART medications are not a cure for HIV, and people with HIV need to continue taking their medications as prescribed in order to effectively manage the virus. Prevention of AIDS. The most effective way to prevent the spread of HIV and AIDS is through education, behavioral interventions, and access to testing and treatment. Some of the key prevention strategies include the use of condoms during sexual activity, avoiding the sharing of needles or other injection equipment, and early diagnosis and treatment of HIV infection. What are pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, in AIDS? Pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, are two prevention strategies for reducing the risk of HIV transmission. Pre-exposure prophylaxis, PrEP. PrEP is a prevention strategy for people who are at high risk of acquiring HIV. It involves taking antiretroviral drugs, typically a combination of tenofovir and emtricitabine, on a daily basis to prevent HIV infection. When taken consistently and correctly, PrEP can reduce the risk of HIV transmission by over 90%. PrEP is recommended for people who are at high risk of acquiring HIV, including individuals with an HIV-positive partner, people who engage in high-risk sexual behaviors, people who inject drugs, and others. Post-exposure prophylaxis, PEP. PEP is a prevention strategy for people who have been exposed to HIV. It involves taking antiretroviral drugs, typically a combination of 3 or more drugs, within 72 hours of exposure to prevent HIV infection. PEP is typically prescribed for people who have been exposed to HIV through sexual contact, sharing needles, or other high-risk activities. PEP should be started as soon as possible after exposure, and should be taken for a full 28 days to be effective. Both PrEP and PEP are effective prevention strategies for reducing the risk of HIV transmission, but they are not foolproof. It's important to use these strategies in combination with other prevention methods, such as condom use, regular HIV testing, and other harm reduction strategies. Additionally, these strategies should be used under the guidance of a healthcare provider, who can help determine the appropriate course of treatment and monitor for any potential side effects. Does HIV go away? No, HIV does not go away. Once a person is infected with HIV, the virus remains in their body for life. While there is no cure for HIV, antiretroviral therapy, ART, can effectively control the virus and allow people with HIV to live long and healthy lives. Combination of drugs. ART involves taking a combination of antiretroviral drugs on a daily basis to suppress the virus and prevent it from replicating. By controlling the virus, ART can prevent the progression of HIV to AIDS, as well as reduce the risk of transmission to others. With effective ART, people with HIV can achieve an undetectable viral load, which means that the amount of virus in their blood is so low that it cannot be detected by standard lab tests. It's important to note that even with effective ART, HIV remains in the body and can still cause damage to the immune system over time. Additionally, people with HIV are at increased risk for other health problems, including certain types of cancer, cardiovascular disease, and neurocognitive disorders. While there is no cure for HIV, ongoing research is focused on developing new treatments and approaches that may one day lead to a cure. In the meantime, people with HIV can live long and healthy lives with access to effective and comprehensive health care. Can I get pregnant if I have HIV? Yes, it is possible to get pregnant if you have HIV. However, there are important considerations for women with HIV who want to have children, as there is a risk of transmitting HIV to the baby during pregnancy, childbirth, or breastfeeding. If you are a woman with HIV and want to have a child, it is important to work with a healthcare provider who specializes in the care of HIV-positive women. Your healthcare provider can provide guidance and support to help you make informed decisions about your options for pregnancy and childbirth. One of the most important steps for preventing mother-to-child transmission of HIV is to take antiretroviral therapy, ART, during pregnancy and childbirth. ART can effectively control the virus and reduce the risk of transmission to the baby. In addition, women with HIV may need to have a scheduled C-section to further reduce the risk of transmission during childbirth. After the baby is born, it is also important to take steps to prevent transmission through breastfeeding. In the United States, it is recommended that women with HIV avoid breastfeeding if possible and use formula instead. In other parts of the world, where access to formula may be limited, healthcare providers may recommend a specific regimen of antiretroviral drugs to further reduce the risk of transmission through breastfeeding. It's important to note that with appropriate medical care and treatment, the risk of mother-to-child transmission of HIV can be greatly reduced. If you are a woman with HIV who wants to have a child, it is important to work closely with your healthcare provider to ensure that you receive the care and support you need to have a healthy pregnancy and baby. In conclusion, AIDS is a chronic, life-threatening condition caused by HIV, which weakens the immune system of the body, leading to an increased risk of developing serious infections and cancers. Early diagnosis and treatment of HIV infection can help to slow down the progression of the disease and improve the overall health and quality of life of people with AIDS. Prevention strategies such as education, behavioral interventions, and access to testing and treatment can help to reduce the spread of HIV and AIDS.